Everyone, and welcome to our very first showcase of our 2021 Virtual Self-Direction Conference Series. My name is Casey DeLuca, and I'm the Director of Membership and Conferences for Applied Self-Direction. Thank you so much for joining us today. I'm going to run through just a few quick housekeeping issues before we begin. You can submit your questions and comments at any time during the showcase by using the Q&A pod in the lower left-hand corner of the Adobe room. If you experience any audio or technical issues during today's presentation, you can send us a message, again, by either using the Q&A pod, or you can also email us at info@appliedselfdirection.com. A reminder that CellTrak is also giving out a $50 Amazon gift card to one attendee today. So at the very end of the presentation, we have a randomizer in the room, and so one attendee will win that gift card. With that being said, I'm going to turn things over to Courtney and Matt from CellTrak to get us started.
Well, welcome, and thank you for joining us for this discussion on electronic visit verification and self-direction. Most importantly, thank you for all you're doing each day to support this excellent care in the home to those who need it most. My name is Courtney Martin, and I'm the lead here at CellTrak for EBB regulatory compliance. I've spent the last several years closely monitoring regulations at the federal level and working closely with states as they create implementation plans. I represent CellTrak within the Partnership for Medicaid Home-Based Care, which is a cross-industry group made up of providers, vendors, and state associations, which collaborates and advocates for providers and patients. I'd also like to introduce my colleague, Matt Garcia. Matt leads the self-direction service line at CellTrak. He has spent over 10 years in healthcare, primarily in home health, working with both software as a service vendors and providers in the Dallas-Fort Worth area. Matt has spent the last 18 months with CellTrak, self-directed customers, prospects, and industry leaders, getting a deeper understanding of the self-directed model, and he leads the charge to help position CellTrak's EVV offering as one that is accepted by consumers and participants as a vital tool in advancing their independence in the care they elect. This is a quick overview of our agenda for today. EVV has certainly arrived on the scene and affects self-directed care now. So to start our session off, I'll be speaking to you about the current status of EVV mandates across the U.S., and I'll provide some insight around how to prepare for and manage compliance. Then I'll turn the session over to my colleague, Matt Garcia, who will introduce you to CareAttend, our solution for the self-directed market. We're here to guide you through the process, and we welcome your questions. So let's start first with a discussion on how EVV implementation is shaping up across states and what that means for compliance in the self-directed community. First, I'll call out that states are at varying stages of implementation and are rolling out unique models to meet the federal mandate. The majority of states, over 85% in fact, are adopting an open model. You will see these indicated in the two shades of light blue on the slide here. What an open model means is that organizations, such as an agency provider or a financial management service, can choose the EVV solution that works best for them. Each FMS needs an EVV solution to manage their population so that they can provide the required data to the state or the MCO payer for compliance and ultimately to ensure that claims get paid. I'll also share that in states with an open model, there may be a single aggregator in place, which means that organizations must relay EVV data to one entity. Those are indicated in the darker blue color. And one thing you should know is that there's also an increasing prevalence of multiple aggregator states. What that means is there can be different entities to relay EVV data to depending on who the payer is. You'll see on the map here numerous states who already have more than one aggregator in place, with potentially more to come. This creates compliance complexity for providers and FMS organizations. You'll note that there are a few states outlined in red to indicate areas where the CellTrak solution is already contracted as an EVV and point-of-care solution for self-directed members. Now, many of you may be familiar with the January 1st, 2021 deadline for compliance with the Federal CARES Act mandate. This was the date where Centers for Medicaid and Medicare Services hold states accountable for demonstrating EVV compliance. States who have not come into compliance risk a financial penalty in the form of a reduction in their federal matching assistance percentage, or FMAP. You may hear it referred to. While many states might be compliant for CMS purposes, most are still fine-tuning many aspects of EBV implementation, such as claims matching criteria, method of oversight, or required format and fields for EBV data. Thus far in 2021, I've seen regular guidance coming as states gain traction, add additional oversight, and continue to solicit provider feedback on what is working well and what could be improved. So on this next slide, we'll explore the topic of how EBV implementation varies by state. The CARES Act is a federal mandate which requires EBV. However, states govern EBV implementation, and they can require more data sooner than the federal government requires. States also make policy decisions around the details of their implementation. I'll tell you first that timelines can vary between states and payers. Some states like Ohio, Pennsylvania, and Colorado were first movers with EBV implementation. Ohio, for example, completed their implementation in 3 phases, with the third and most recent concluding on January 1st, 2021, with the self-directed and home-based therapy waivers. Although they're compliant for federal purposes, they've not yet implemented any claims penalties and are still monitoring implementation, as well as soliciting feedback from stakeholders. Second, each state individually decides which services are included on the list of EBV mandated services. Now, the majority of states, about 63%, have opted to implement personal care first, come back to home health services prior to the 2023 federal deadline. However, a full 35% of states have home health included now on their required list. And so in those states, home health providers have to be prepared. Any organization, such as an agency provider or an FMS, that oversees or administers care must compare the services they provide in any given state to the required services issued by the state or the MCO payer so they can manage EBV for these services proactively. Third, and very important for the self-directed market, is that states can individually decide whether live-in caregivers are included in the EBV mandate as they require in Arizona, or whether they're exempted from the EBV mandate as they are in Wisconsin. In self-direction, this is a key distinction because in some cases the caregiver, typically a family member, lives with the patient and assists with care. So in the case where a state chooses to exempt that live-in caregiver situation from EBV, the state will often require documentation annually or inclusion of a special modifier which indicates this live-in situation. Also understand that this is a snapshot of EBV requirements today, but that I've seen EBV requirements evolve regularly among multiple states. I've seen many instances of revised deadlines, updated requirements, or the addition of a new payer or aggregator in the state. Now, a good number of states have been proactive in gathering stakeholder feedback and monitoring implementation progress. And so what they're doing is they're making positive changes in response to that feedback. But just know that it's important to stay up to date on the requirements in every state where you operate. Now, when EBV applies, an FMS has 2 obligations with respect to EBV. The first is to collect correct, compliant EBV information at the point of care. And the second is to relay that information to the state and the MCO payers who require it. Each payer has specific EBV requirements unique to their implementation, and organizations must provide the right data required by the state or by the MCO in the exact right format, often in near real time for claims matching. Now, if you're wondering how to determine whether you're affected by the mandate, there are 2 criteria. One is that Medicaid pays, and 2, the service is included in the state guidelines. So check the services you deliver against the list for each payer or state that you operate in to make sure that you're documenting correctly and that you're prepared to share EBV information when it's required. Now, what I want to do now is put up a polling question. The polling question just asks, how many states or payers are you currently required to submit to? So in some cases, you may not know because the state is still working on guidance. In other areas you operate, maybe you know that there's only one or that there are multiple. And so I just thought I'd give everybody a minute to answer this question and talk a little bit about about the results that we see. So you see here, there are a number of responses waiting on aggregator, which makes total sense because there's some states that are have not actively rolled out EBV implementation yet because maybe they're making some purchasing decisions at the state level, or they decided to take the penalty to give themselves a little bit more time to implement. So in those cases, when an aggregator is put in place, then those requirements will roll down to providers of service. You'll see a large number that have 1 to 2, and that means that they're either relaying to one state aggregator or maybe one state, one MCO payer. And then additionally, some people that have more complexity. In some states, there are payers that are maybe 1 or 2 or a handful, and some there can be upwards of 10 or 20. And so providers who operate in those states need to be prepared that they're going to have different requirements by payer, and that they're also going to need to relay information potentially to multiple places. I want to move on to the next discussion around how to simplify EBV implementation. Working with organizations in many states over the last several years. Many had implemented EBV prior to the mandate, but are still working towards streamlined compliance. Over the course, I've seen several paths, from the one at the top, which is this quickly 2 steps forward, 1 step back approach, to moving around an obstacle, potentially a large issue that they have to accommodate, or the smooth and direct approach to EBV compliance. And so I've learned a few things along the way around best practices, and I wanted to share them with you. So the first is to choose one system for all visits, regardless of payer and regardless of whether the service is mandated or not. Having a strong EBV solution provides the opportunity to simplify operational workflow and to stay in touch with your caregivers and your patients in the field. Secondly, prioritize interoperability. If you choose an EBV solution that can work with the systems that you already have in place, potentially an electronic medical record solution, payroll or billing, you'll minimize disruption in your operations when you implement. And finally, focus on how you can reduce administrative burden on your staff and on your caregivers. Look for opportunities to streamline the administrative workflow. Give the caregivers a tool to use that is simple and straightforward and even easier than just completing and turning in a paper timesheet. Although EBV is a significant operational change, we do know that it helps to ensure the highest quality of care in the home. We're here to help you through this process. And now I'll turn it over to my colleague, Matt Garcia, to share his insight and show you our CellTrak solution for self-directed care attend in action.
Thank you, Courtney. Incredibly insightful EBV information for self-direction. CellTrak is a national EBV provider and has an abundance of experience working with aggregators and MCOs in open states across the country. CellTrak teams include experienced individuals who have spent time within provider settings with direct EBV responsibilities. As a CellTrak customer and partner, our teams provide EBV education, support, attend state calls, advocate on your behalf, and provide updated state and federal mandates to ensure your organization is focused on what you do best. Required data needed to satisfy the 21st Century Cures Act and EBV requirement will be collected via Keratin to help reduce fraud, waste, and abuse. Today, CellTrak has 30 EBV connections across the country, relaying EBV data to more than 190 different payers. The 21st Century Cures Act has resulted in complicated and ever-changing state-by-state compliance requirements. With new payers and MCOs making bids in states, closed states moving to open, and unique sets of data elements requested across the board, CellTrak simplifies EBV with one interface to make the appropriate connection for all. CellTrak at a glance. CellTrak is new to self-direction, so you may have not heard of CellTrak prior to today. Here are a couple of fun facts about CellTrak. We are headquartered in Schaumburg, Illinois, which is just outside of Chicago. We were founded in 2006, and we provide our mobile services to home health and the home care market and obtain self-directed customers throughout the last 18 months. CellTrak is operational and has team members across the United States, Canada, and the UK. I will now provide a walkthrough of the CareAttend mobile application and CareAttend portal to show the seamless workflow from EVV and time capture in the hands of an attendant to the shift record in the office setting. I am currently using an Android Galaxy S6. CareAttend can be used on both Apple and Android platforms with a simple download from the respective app stores. I currently have my CareAttend app displayed on my home screen for easy access, as you can see right here. Tapping on the CareAttend icon launches the app to begin the shift for the day or shifts for the day. Once in CareAttend, you will be prompted to enter your passcode to be given access to the application. FMS or self-direction providers will have the option to utilize SSO or single sign-on if your organization has that capability. If SSO is not an option for the organization, registration to CareAttend application via an email address will be the standard. I now will input my passcode and log in. Once in CareAttend, attendants will arrive at their home screen. This screen is intentionally developed to be intuitive and offer an ease of use to navigate towards new shifts. Tapping on the purple New Shift icon at the bottom of the screen takes the attendant to a list of consumers who they are associated with and can provide care to. As the attendant in this example, I will select the consumer receiving care for the shift I'm about to begin. Tapping on the next icon to advance to the next screen, attendants will be asked to select the service that is being provided for the current shift. In this example, I have respite care and personal care to choose from. I will select personal care and tap on the next icon to advance to the next screen. I am now presented with a confirmation page. Am I ready to provide personal care services to Jager Garcia? If I am, with the correct consumer and providing the correct services, I will tap on the Start Shift. I do have the option to return to previous screens with the back arrow at the top left, or to return to the home screen by selecting the X at the top right. I'm going to select Start Shift. Tapping on Start Shift will begin the shift. CellTrak has enabled the CareAttend app to pick up the GPS shift only at the start and end of shift times. All other GPS locations will not be recorded prior, during, or after the shift. We understand self-direction promotes independence of the consumer, and our GPS collection was built to be non-intrusive while also satisfying EVV requirements. At the top of the screen, attendants will see the current date, Thursday, May 20th, and the details of the active shift below. Our consumer, Jager Garcia, our services, personal care, and a running clock that will keep the time from start to finish of the shift. In the below green box, attendants will notice a message. Please complete one or more tasks to end your shift. Tasks are one of the many configurable items that may be enabled or disabled in the mobile configuration via the CareAttend portal, providing custom workflows for multiple state programs. Tapping on the task box will bring attendants to the task page, where they must complete at least one task to end their shift. Our elapsed time is displayed at the top of the screen, and the required tasks are available for selection under the service. In this example, personal care. To the right of each task, you will see the I or the information, which will provide details about that specific task. This text is configurable for each of the tasks listed. Once a task is complete and selected on the screen, the End Shift icon appears at the bottom. When tapping End Shift, attendants are presented with the service summary screen. Service details are displayed for review. The beginning or the start time of the shift, the date of the shift, the consumer receiving the care, the services that are provided, and the tasks that are provided. The below time shows the end time when the shift is completed and the date for that specific shift. Scrolling down on the screen displays the total time spent in the shift prior to obtaining signatures. Should an attendant need to adjust their shift times, they are able to do so by selecting Make Adjustments. Information provided by the FMS or Self-Direction Provider organization will appear regarding the adjustment of times. Selecting Enter Adjustments at the bottom of the screen will allow the attendant to make the appropriate adjustments for the start and or finish times, end times. Attendants can adjust the day and or time. I will move the time back 2 hours on the start time by pressing in the box and pushing this back 2 hours. Selecting the OK button and noticing that the time has been adjusted. The original time is on the left. The adjusted time is within the box on the right. I will leave the end time as is. There is logic built into the adjustments that will prevent an attendant from starting a shift with a future day or time, ending a shift with a future day or time, or ending a shift with a start time that comes after the end time. By selecting the Next button, I am taken to the Adjustments page. Reasons for adjustments will have to be specified. Another custom setting within the CareAttend portal to provide your own workflows. Once times are adjusted, our total time is displayed and our shift is ready for signatures. So it has now updated for 2 total hours. Tapping on the sign icon at the bottom of the screen will provide an attestation. This, again, is a custom attestation created within the CareAttend portal. Tapping in the box will rotate your device to a larger area to sign. Accept allows me to sign that for the attendant. Tapping recipient signature displays the recipient summary page, displaying the time, the attendant, the service, and the task. In this case, Jager Garcia, the consumer, is also shown the adjustments made. Tapping in the box allows for the consumer to sign off on the services provided. Once signed and submitted, the shift is completed, and the attendant can return to their home screen. Let's now take a look at the CareAttend portal. A quick walkthrough of the portal shows a menu to the left of the screen. Selecting Shift provides the shift data completed on the Care Attend mobile application. And I will refresh my screen. The visit I just completed can be found within the shift screen. And when selecting the shift line, I am presented with shift details as a pop-out from the right. So this is the current shift I just completed. By selecting that line, I now have my pop-out. I see an overview of the shift, task, and the verification tab. The overview will show me submitted times, also showing that it's been adjusted, device capture times, the actual times provided, and additional information. So who it was performed by, the service, and as mentioned earlier, just the start and just the end GPS. Under tasks, it will show those tasks that were completed. In the shift that we just completed, we only selected eating, and this is all that appears in the portal. Under verification, we display the signatures obtained within the shift. Let's jump down to setup and review the attendant workflow configuration. While in the Care Attend app, there were a number of configurable items organizations could customize for their own workflows. This is where Care Attend gives you control over what is shown in the mobile application. I currently have two configurations set up. I will quickly walk through the Chicago example. When selecting the example, I again see a summary that pops out from the right. I will quickly review this step by step. I have the ability to adjust the configuration name, so that can be by state or program or payer, and I can select locations. Locations currently will be added on the setup of the site, but you would be able to assign locations to each configuration. By selecting the next button at the bottom right, I can review or select whether or not my configuration will have tasks. In the shift we just completed, we had tasks. By moving that radio button, I can set up a configuration without tasks. Under aliases, we have the ability to provide the correct nomenclature for the correct states you are in. Some states may refer to consumers as consumers or clients or recipients, and we want you to be sure you are using the correct terminology for your organization in your state. Same for attendance and shifts. Visit adjustments. Can you select visit adjustments or update visit adjustments on your mobile application? If yes, you have further reasonings. Are reasons required? If yes, what are those reasons for a visit adjustment? The signatures and attestations that we reviewed on the mobile application are also a configurable item. Can you add an attestation? And there is a text box for you to fill out the correct attestation for your mobile device. Once saved, we have that particular configuration set up. With the remaining time, I will go back to our PowerPoint as we close out our session and turn it back to Casey.
Great. Thank you so much, Matt and Courtney. We have gotten a few questions, so I'm just going to jump right into them because we don't have a lot of time left. The first one came in, Matt, when you were doing your demo. Are these scheduled visits? How does the app know what client to select?
It's a great question. They are not scheduled visits. CellTrak will have a relationship file that we will work with an organization to ingest via an API, and the attendant and the caregiver will have a relationship, which we call the care team. And within that, we will specify the services that are required. So in my example today, personal care or respite care are a part of that. and any tasks that are associated. So it is unscheduled and it is handled through a relationship file.
Great. So we're going to go a little over to keep answering some questions if folks are able to stay on. We're also recording this, and so we'll be sharing the recording afterwards if you need to jump off. Next question, is signature the only option for the person receiving care to approve the shift?
So there are options to not obtain a signature. So if for whatever reason we cannot obtain that, you can move forward. There will be a reason for not obtaining it. We will move to having signatures via voice, voice verification. But currently, right now, it is signature-based.
Okay. Next question. Can the recipient attest for multiple visits together?
Yes, so that is what CellTrak would refer to as shared care. So we would be able to move forward with one attendant caring for two caregivers or consumers, I'm sorry. So yes, we would be able to move forward with that.
Okay, and then last question I'm seeing, does it work without internet?
It does. As long as you have connection to be able to have the information to turn on your device, enter your passcode, and get to that home screen, you will have the relationship file already on your phone, and you will be able to select your consumer and the service and begin the encounter or the shift. And then once you return to an area with Wi-Fi or cell connectivity, then that information would be transferred back to the mobile office or to the portal. I'm sorry.
Great, thank you. So we are getting some more questions. What I'm going to do, I'm going to go ahead and do our randomizer real quick. And then, so we have Eric Costa has won a $50 Amazon gift card from CellTrak. So Eric, we'll follow up with you after the session by email, but congratulations. And Matt and Courtney, do you have a few more minutes to keep answering some questions?
Absolutely.
Okay, great. So the next question was from a group that has been using CellTrak, and they were wondering if what you just demoed was a newer version that you're rolling out for existing clients as well.
It is a new self-directed application that we are rolling out. So we have our current, what we call our version 2 or agency application. That is what they're likely using today, and that's geared toward our home health and hospice and home care markets. This Care Attend app that we displayed today is specific for self-direction, and we would absolutely be willing to have conversations around moving them over from one app to the other for self-directed purposes.
Okay, great. And maybe we have time for 2 more questions. Next one, what systems do you interface with for billing and payroll?
So that is a very good question that I will have to be honest with you and likely have to get back to you and have our development team take that one on. There are a lot of systems out there, and I don't want to misrepresent what we can and cannot work toward. So happy to provide a better detailed answer after the session with a follow-up, if that's okay.
Great. And then last question, Matt, can this be on the consumer's phone?
It can, yes. So it's we have a bring your own device policy. So if a consumer brings this, they're able to download it from the Apple Store if it's a iPhone, or an Android, the Google Play Store if it's an Android device. So yes, easily downloadable from any of the respective Play Stores to any phone that a consumer or an attendant may have.
Great. Well, thank you both very much Courtney and Matt, we really appreciate you taking the time to demo care attend for us. And like I said, this session has been recorded and we'll send out an email afterwards with the link to that recording. So thank you all very much and congratulations again, Eric.